Foods to avoid during pregnancy. According to American Association of Obstetricians and British National Health Service, the following foods should avoided. 1. Avoid unpasteurized foods. Foods made from unpasteurized milk, such as soft ripened goat's cheese, unpasteurized cow's milk, goat's milk, sheep's milk or cream. Why these are dangerous? There's a small chance that unpasteurized or soft ripened dairy products may contain Listeria bacteria. This can cause an infection called listeriosis. Listeriosis can lead to miscarriage or stillbirth, or make your newborn baby very unwell. Soft cheeses with a white coating on the outside have more moisture. This can make it easier for bacteria to grow. Cooking cheese until it's steaming hot kills bacteria, reducing the risk of listeriosis. 3. Avoid raw, undercooked meat, excess liver, and liver products, and all types of pate, including vegetarian pate and game meat such as goose, partridge, or pheasant. Why these foods are dangerous? There's a small risk of getting parasites, toxoplasmosis, if you eat raw and undercooked meat. This can cause miscarriage. Cured meats are not cooked, so they may have parasites in them that cause miscarriage. Liver and liver products have lots of vitamin A in them. This can be harmful to an unborn baby. Game meats may contain lead shot. 4. Avoid raw, undercooked or contaminated seafood. Seafood can be a great source of protein, and the omega-3 fatty acids in many fish can promote your baby's brain and eye development. However, some fish and shellfish contain potentially dangerous levels of mercury. Too much mercury could harm your baby's developing nervous system. The bigger and older the fish, the more mercury it's likely to contain. During pregnancy, the Food and Drug Administration, FDA, encourages you to avoid big eye tuna, king mackerel, marlin, orange ruffly, swordfish, shark, tilefish. 5. Avoid undercooked poultry and eggs. During pregnancy, you're at increased risk of bacterial food poisoning. Your reaction might be more severe than if you weren't pregnant. This can cause miscarriage. 6. Avoid unwashed fruits and vegetables. To eliminate any harmful bacteria, thoroughly wash all raw fruits and vegetables. Avoid raw sprouts of any kind, including alfalfa, clover, radish and mung bean, which also might contain disease-causing bacteria. Be sure to cook sprouts thoroughly. 7. Avoid excess caffeine. While caffeine can cross the placenta, the effects on your baby aren't clear. To be safe, your healthcare provider might recommend avoiding or limiting the amount of caffeine in your diet to less than 200 milligram a day during pregnancy. 8. Avoid herbal tea. There's little data on the effects of specific herbs on developing babies. Since the safety of most herbal tea is not known, it's medically not advisable to take it. 9. Avoid alcohol. No level of alcohol has been proven safe during pregnancy. The safest bet is to avoid alcohol entirely. Consider the risks. Drinking alcohol during pregnancy leads to a higher risk of miscarriage and stillbirth. Drinking alcohol may also result in fetal alcohol syndrome, which can cause facial deformities and intellectual disability. 10. Avoid fresh squeezed juice in restaurants. Pregnant women should opt for juice that is pasteurized. Fresh squeezed juice in restaurants, juice bars, or farm stands may not be pasteurized to protect against harmful bacteria, including Salmonella and E. coli. Some markets also sell raw, unpasteurized juice in the refrigerated case. Look for the required warning label and steer clear. Juice in boxes and bottles on your supermarket shelf may be safe. Juice in boxes and bottles on your supermarket shelf may be safe. For more videos like this one, please subscribe, like, and even leave a comment. Have a nice time.